Myself Sneha Jagdishan, working as a nursing tutor in ES College of Nursing. Today I am going to present a topic about diphtheria. It is an acute infection caused by toxigenic strains, especially of Corynebacterium diphtheriae. They basically multiply locally, usually in the throat. Then it enters into the pharynx and a well-defined edges. The membrane cannot be wiped away. These were the false membranes, which is grayish or yellowish membrane, commonly coat over the tonsils, pharynx and the throat. Epidemiological determinants. The bacteria causing agent of this diphtheria is Corynebacterium diphtheriae. Host, it mostly occurs to the children of 1 to 5 years of age, and environment it occurs. Epidemiological determinants. The agent causing diphtheria is Corynebacterium diphtheriae. The host factor, mostly it affects children of 1 to 5 years of age. Commonly it occurs in the winter season. Next we move on to the agent. Already I have told Corynebacterium diphtheriae, it is a gram-positive non-motile organism which is the causative agent for the diphtheria. Source of infection, it can be occurs through cases and carriers. Infective material, nasopharyngeal secretions, discharges from the skin lesions, and also contaminated fomites and possibly infected dusters or the infective materials for the diphtheria. Next, infectivity. Infective period mostly occurs 14 to 28 days in a body. In some cases, it may remain more than much longer period than 28 days. Immunity. Infant born with immune mothers are relatively immune during the first few months of life. Children in developing countries seems to be acquired immunity through vaccines. Period of infectivity, already have told, 14 to 28 days. Host factors. Age. Diphtheria usually affect 1 to 5 years of children. It affects both female and male children. So, environmental factor. It occurs in all seasons, mostly common in winter months. Mode of transmission. The disease is spread mainly by the droplet infection. It can be transmitted directly to the susceptible persons or from the infected cutaneous lesions. Transmission by objects. The objects which we used to carry like cups, thermometers, toys and pencils contaminated by the nasopharyngeal secretions of the patient has the possibility to cause and spread infection to other people. Portal of entry. Next, in portal of entry we will see there is two routes of portal of entry. One is respiratory route and another one is non-respiratory route. In respiratory route it enters through the respiratory tract, that is nose. In non-respiratory route it enters by our skin, where cuts, wounds or any ulcers or any injuries present in our body. And also it may get infected with diphtheria bacilli. In umbilical cord too. Incubation period 2 to 6 days, occasionally longer. Types. There are 4 types of diphtheria. First one is pharyngotonsillar diphtheria, second is laryngotracheal diphtheria, and third is nasal diphtheria, fourth is cutaneous diphtheria. Symptoms of diphtheria. First, the patient who is affected with the diphtheria will have sore throat, swollen glands in the neck, barking cough, raising heart rate, and also wheezing and difficulty in breathing. This patient may also have fever and chills. Clinical features of diphtheria. Diphtheria affects ears, nose and throats, already we have discussed. It's according to its types that there are characteristics of clinical features. First one, pharyngotonsillar diphtheria. In pharyngotonsillar diphtheria, the patient may have sore throat, difficulty in swallowing, restlessness and fever. A whitish membrane is found on the tonsils which can't be wiped off. This can be easily wiped off. Later it becomes thick bluish white to grey color, and it is difficult to remove if tried, and also results in bleeding. Lymph glands around neck will get swollen and give bull neck appearance. Edema of submandibular area, mucosal edema around the membrane will be formed. Secondly, laryngotracheal diphtheria. In laryngotracheal diphtheria, the patient may have breathing difficulty, hoarseness of voice, severe irritating cough, and also infection may spread into the respiratory tract and can cause serious conditions too. Next, third type, nasal diphtheria. Mucus and blood became from nose and one side of the nostril may be blocked, and also the membrane is formed. Difficulty in inhaling also occurs to the patients. The patient may feel breathing difficulty. Cutaneous diphtheria, this is the last type. Here the common in tropical areas. It often appears in a secondary infection of a person's previous skin abrasions or lesions. The presenting lesions, often an ulcer, may be surrounded by the erythema and covered with membrane. Non-respiratory mucosal surfaces, that is conjunctiva, genitalia, may also be the sites of infection in this type of diphtheria. Next we move on to the diagnosis. Diagnosis made from the clinical signs and symptoms of the patient. Then also we will do examination of the nose and throat, and also presence of diphtherial membrane will be checked. Next, Schick test is done to the known whether the individual is susceptible to corynebacterial diphtheria. Schick test is the confirmatory test for diphtherial diseases, and also common laboratory tests will be done, and also laboratory tests includes examination of the nose and throat secretions will be done for this diphtheria patients. Next we move on to the management of diphtheria. If the patient is occurring suspected and confirmed with the diphtherial diseases, we'll do first point is to detect and hospitalize and also isolation, because it is an infectious disease. We used to isolate these kind of patients. Next, notification of the disease to be informed to the concerned authorities and the patient. Next, DPT antitoxins, that is 10,000 to 80,000 units should be given IM or IV depending upon the severity of the disease, and also physician's order. Antibiotics should be administered to the patients to prevent infection multiplication. Antibiotics such as sodium penicillin 2.5 lakhs QID, that is 4 times a day for 5 days, or injection erythromycin 250 mg 4 times a day will be given to this diphtheria patients. In case of laryngotracheal diphtheria, if respiratory stridor is present, tracheostomy may be required. Care of tracheostomy tube and general care of the patient is recommended in these kind of patients. These are all the basic management of diphtheria. Next we move on to the prevention. All we know that prevention is given by immunizing the patient. Immunization by triple vaccine, that is diphtheria, pertussis and tetanus is given to this patient from, and also these vaccines are immunized from the birth of the child, that is at birth of the child, then age of 6 weeks and age of 10 weeks and at the age of 14 weeks, and then booster doses also given. This is the vaccination schedule, especially only for the DPT. At 6 week DPT 1 0.5 ml IM antilateral side of mid thigh will be administered. Next, at 10 weeks DPT 2 0.5 ml IM antilateral side of mid thigh is administered. At 14 weeks, same DPT third dose 0.5 ml IM antilateral side of mid thigh is administered. As booster doses, first booster doses will be given at 18th month 0.5 ml IM antilateral side of mid thigh. Next, second booster dose will be administered in 5 to 6 years 0.5 ml IM antilateral side of mid thigh. Complications of diphtheria. Now we'll see the systematic complications of diphtheria. First, CVS typically occurs after 1 to 2 weeks of illness. Myocarditis, arrhythmia and CHF is the complications of CVS system. Next, respiratory system. Respiratory failure may occur in such cases. Then renal, tuber complications. Firstly, we'll see in CVS system typically occurs after 1 to 2 weeks of illness. Myocarditis, arrhythmia and CHF may occur in the diphtherial patients as complication. Next, respiratory complication, that is respiratory failure, renal tubular necrosis, proteinuria may occur. Next, neurological. Palatal palsy in the second week may occur, that is nasal regurgitation of fluids, nasal intonation of voice may occur in this kind of complications. Ocular palsy, this occur in the third week and there will be a deviation of eyes. Loss of accommodation, that is blurring of vision, may also one of the complication. Next, generalized polyneuritis. It occurs in the 3rd to 6th week. Some other complications, there is maybe a chance of palsy of cranial nerves also be seen. Polyneuritis manifested as motor deficit of proximal muscle groups. From weakness to complete paralysis, there will be any diminished DTR, and also descending paralysis Descending paralysis may also occur. Cutaneous diphtheria, painful blister-like skin lesions which break down to form an ulcer, also may occur, which will turn to grey membrane. Thank you.